All right, so we're live. It's Friday. I had a statement on the YouTube the other day, and the patient said they couldn't see, the person said they couldn't see the herniated disc. So I put together a presentation today that helps illustrate better the image so you can physically see it, because sometimes when they're small, they're kind of hard to see, or you don't really know what you're looking at. So my goal is to make sure that you get the information you need, because if you can get it, then you can get your life back. So massive herniated disc eliminated with our treatment. In this case, it's a pretty obvious visual because it's pretty big and you can see it. And this is me right here. So we treat back pain, and we treat back pain as a result of something that happened to me in 1988. I smashed my low back. I damaged my disc, but I was young and naive and didn't do anything about it, and I struggled for 10 years, getting worse every year, struggling with this back pain. And it affected me in many, many ways. I couldn't do what I wanted to do with my life. I couldn't, it hurt to cut the grass, it hurt to play with my kids, everything hurt. You've had it, it was awful. It affected me emotionally. And eventually I found a way out. And I found a way out, and we put together, as a result of my sort of finding a way out, a program that eventually we refined to where it solves even the most complicated back problems. So it's something that's been developed over the last 25 years, but it truly is a solution for chronic back pain. There is a way out. And it is my mission now to eliminate back pain from the planet, because quite frankly, you can solve it, you don't have to live with it, there is a way out. And the way out is not drugs, nor is it surgery. We have a process, functional disc stabilization, that takes the pressure off the discs. Real quick, I'm going to recap. Between the head and the hips, there's 24 vertebrae. In between the vertebrae are the bones. In between each bone, there is a disc. The disc allows for motion of the vertebrae. Each vertebrae is designed to move in 6 directions, forward, back, side to side, and rotate. Now, in between, again, is that disc. And that disc is a lot like a jelly donut, in the sense that the outside of the disc, so one vertebrae on top of the other, here's the disc. The outside of the disc is the annulus. The annulus is the thicker portion. Inside is the nucleus. The nucleus is like the jelly of the jelly donut, but the nucleus can move. And through everyday activities, wear and tear, what happens is the annulus can start to get a little bit weaker. Okay? When you flex all day long and move back and forth and do the same motion all day long, the disc starts to break down. And that breakdown creates a weakness. And then sometimes that weakness will develop a little tear. And sometimes what will happen is that nucleus will start to push out. And as that nucleus starts to push out, sometimes you'll develop what's called a bulging disc. And then sometimes over time, as that tear gets bigger, the nucleus pushes out further, you'll develop what's called a herniated disc. So the disc will push all the way out into the spinal canal, and it'll start to pinch the nerves. It'll start to cause sciatica. The number one reason people have sciatica, the pinching of the nerve, is the herniated disc. Looks like this. Okay, this is the small version. So I show this image a lot, like this is what happens, this is the herniated disc, but I want to show you Thomas. So Thomas came into our clinic. And when Thomas came into our clinic, he'd had this back condition for over 6 months. But for the most recent 6 months before he saw us, he was stuck forward in a flexed position. He could not physically stand up because the herniated disc was so bad. And he was rotated, and he had to walk with a cane. And he had to walk with a cane because he was going to fall down without it. The pain was so bad he couldn't physically stand up. He'd been in many specialists. He had tried the injections. He tried all the other therapies that didn't get him better. In 2 weeks, he was scheduled for a surgery. He came to see us before the surgery. Massive herniated disc. Massive herniated disc. Okay? All this disc material should be inside the disc. So everything here is the herniation. It was so big, it was squashing the spinal cord. He tried other therapies, had a massive disc problem, was scheduled for surgery, came in. Everything that we do is without drugs or surgery. We decompress the disc, We reactivate the muscles. It's called functional disc stabilization. We restore function and we reactivate muscles without drugs or surgery. Okay, it's active decompression with physical therapy. He came in this forward stuck position. We got him into the program. It took a while. Okay, massive herniated disc. Took 6 months, but he went through the program. And at the end of the program, the herniated disc was gone. My goal again is so you can see it. This is it here. Massive herniated disc pushing into the spinal canal. At the end of the therapy, the herniated disc was gone. We treat more herniated discs than anybody. We treat more sciatica than anybody because they're connected, right? It's not uncommon. You have one, you have the other. Okay? We treat more than anybody. And we treat it with our patented process. We have a patent process to identify where the problem is. We also have a patented process to solve it. And you get better. So, it's my mission to eliminate back pain from the planet because it can be done. There's people right now that are addicted to opioids because they have a disc problem. Sometimes the only way to get rid of the disc problem is through what we do. The medicine doesn't help. Surgery sometimes makes you worse. We have a case study that's published in a medical journal. She was made worse from the surgery. She wanted to kill herself. The pain can be that bad. The pain can be that bad, and if you don't think it's ever going to go away, you can't live. Okay, I had it. There was a time I went with my family to Florida, and I got stuck in bed for a week. That's not life. That's not living. I need your help. I need your help to share this information. People need to know what we do. People don't know what we do. People don't know they have solutions. People don't know there's a way out. I want you to like this video. That'll help. I want you to subscribe to our channel. That'll help. I want you to share our information. Anybody you know that has a back problem that's not getting better, they need to see this because they need to know there's a way out. Sometimes you're trapped. You feel like you're trapped in a room, like I can't get out. There is a way out. And then comment. If you have any questions, I get a lot of questions. Some are good, some are maybe not appropriate, but I get a lot of questions. Okay? I want to answer your questions. The question was, I don't see the disc. Okay? I think I made it bigger so you could see it. And this is a big one. Okay? And this is a severe one. This is one of the biggest herniations we've seen. We've seen bigger. You know, we had the one do herniated discs go away, or yes, herniated discs go away. I don't know what the video is, but it's a massive herniated disc. This is a massive herniated disc. They go away, but the problem is they don't go away overnight. But you have to know they do go away if you do the right treatment. So if you have a problem, share this information. If you live anywhere, well, we get people who fly in from all over the whole world to come see us to solve this problem. Because when the pain's that bad and you can't deal with it, you'll fly. 844-577-7329. You can call us. I'm going to start doing Skyping and go-to meetings where I can talk to you because a lot of people have questions. I have this problem. What do I do? There's ways out. I can help you out. I can get you out of this. There's not too many back pains we can't get rid of. We've got 2 scientific studies published, a third one with 1,200 patients that all needed surgery that got better. 1,200. It wasn't 2, it wasn't 20, it wasn't 200. It was 1,200 in this case, in this study. So we have a solution. There is a way out. You don't have to struggle. That's it. Give us a call, 844-577-7329. I want you to like it. I want you to subscribe to it. I want you to share it. I want you to comment on it. Again, if you have a disc problem, we can solve it. Nobody else solves it. We can solve it. That's it. Be aware we can help you. Have a good day.